Can't believe how how brightly that is shining on me. It's 5 o'clock in the morning. I just had a bath. I'm about to go to bed. My sinuses are in excruciating pain. Couple days of excruciating pain here. CPAP and the damage that this ENT surgeon did to my sinuses, the pain that I'm in. I had this surgery 13, 14 years ago. He did this massive, all this stuff that I didn't consent to. Cut out the inferior turbinates, cut the middle turbinates, cut open the maxillary sinuses, cut these sinuses wide open and left them open, cut out the bone and tissue in the nose, like basically cut everything out without my consent, without informed consent, and without telling me what he was doing. And it wasn't an accident, it wasn't an oversight. I said, don't touch the right side before going into the surgery. And it's been chronic pain ever since. And I didn't know. See, here's the thing. They're doing these extensive surgeries on people without telling you. And then you're sick after, and you're sick for years, and you don't know what happened because you can't see inside the sinuses. And then you get a CT scan years later, and you see what the shot, you see the damage, the extensive work they've done, and you're shocked. Like, I have been in chronic pain ever since this surgery, and I've been, telling doctors, and they knew. There were doctors who asked me, family doctors, who asked, what did you get done? And he said he was going to do a little bit of trimming of the flesh so I could breathe easier. And he just did this massive resection. He just cut everything open, cut everything out. And when these doctors looked at the report, they could understand the language, what this guy did to me, but nobody would tell me. They were too afraid to tell me, or they didn't want to be the guy to spill the beans. They didn't want to be the person to tell me the truth. And then I'm mad at the surgeon, and then I'm calling the surgeon to say, what the heck did you do to me, right? They didn't want to be that guy, quote unquote. So nobody told me. And just the suffering continued, chronic sinus infections and chronic pain, and doctors giving me opioids for the pain. And I've had pharmacists say to me, why are you getting opioid? Why are they giving you opioids? And I didn't know they were opioids. I didn't know what an opioid was. This was right before the epidemic. And the opioid epidemic here. And I didn't know I didn't know what an opioid was. I didn't know names of opioids. And I said, well, number one, I didn't, what's an opioid? I didn't know what an opioid was. And they told me, and I was always warning them, don't give me anything strong because there's something wrong with my breathing and drugs. And they would go ahead and prescribe opioids despite me warning them. And I've had pharmacists say, "Why are they giving you opioids?" And I'd say, "For sinus pain." And they'd say, "That did you just have surgery?" And I said, "No, I had surgery years ago." And they said, "Well, that's not right. Why would they be giving you opioids for your sinuses?" And I'd say, "Because I'm in extreme pain." And they'd say, "Why are you in extreme pain?" I'd say, "I don't know. My sinuses hurt so bad, I'm losing my mind." And doctors would give me opioids. Well, I'm in excruciating pain. I didn't know what like it made no sense to people. Why are you in that much pain with your sinuses? I don't know. And then finally, I've got all these health issues and no answers to what's happening. So finally, what I did was I started weaning off all the medications I was on to fight for proper health care and to fight for answers. Why am I sick all these in all these ways? Why do I no longer sleep? Why can't I breathe in bed? Why am I in excruciating sinus pain? So I weaned off of all the medications I was on. I weaned off of everything to fight for answers, to fight for healthcare, to see if anyways. So I went and got a scan of my sinuses, a CT scan, copies of the last scan. Honestly, what I was looking at, I couldn't comprehend, like the trauma of seeing the image. I couldn't comprehend it, and I put it on, literally, I put the CT scan on my shelf for about 2 years till I could go back to it and actually face what he had done to me. And he'd done far worse than I understood, that far worse than I realized. And they can't repair it. None of the ENTs here want anything to do with me. The amount of damage he's done and what he's actually done, there are some doctors in the world, ENT surgeons, that are experimenting, doing implants. Like they'll take cartilage from your rib, or they're doing fat injections. They're doing cadaver cartilage implants. And it's all experimental, right? There's no guarantees, and I'm too ill there's no way I can travel the world to get this fixed. And besides that, you're traveling to other countries. None of this is guaranteed. It's all experimental. And chronic sinus infections since the surgery, and now I've been on CPAP for sleep apnea for 6 years, and it has been excruciating pain. Unbearable pain. And honestly, I can't believe I'm still here. I'm in excruciating pain right now. All throughout, all here, and throughout, deep in the nose, everywhere, in excruciating pain. And you know what? I finished antibiotics about a week ago. I'm going to contact my doctor. Like, doctors can't handle this. Doctors do not want to overprescribe antibiotics. I don't want antibiotics. I'm in excruciating pain. Something has to be done. And they don't know what to do. It puts the doctor in a bad position, And it puts me in a bad position, right? Because I'm pushing and pressuring doctors, whoever is my family doctor at any given time. I'm pressuring them and pressuring them. I need help. I need help. And now tomorrow I'm going to have to approach him, message him, call him, or whatever. And you know what? I just finished antibiotics a week ago. I'm looking for the bottle. I'm in excruciating pain. Are they infected? I have no idea. How can someone be in this much pain and not be infected? And like, they don't know what else to do. There was a doctor, and I talked about this once before on a video, a doctor of whatever, I don't know what he's a doctor of, but you know, he had the same thing wrong with him that I do, that same cut apart sinuses, and he had to go on CPAP for sleep apnea, and just excruciating, and he took his life a year ago. I saw someone posted messages, and I went and looked, searched around on the internet for him, this doctor, leaving messages on different, not messages, but making posts and stuff on different platforms. And he talked about that it's unbearable, the CPAP, and this is unbearable. He's the only human being that I know that had this much extensive damage, and he's on CPAP, and he's like, this is inhumane. And he took his life a year ago. He's the only one I know that's on CPAP and suffering like a dog, and he took his life. This surgery, this extensive damage, you're setting somebody up, this is like destroying somebody's life. These surgeries, these drastic surgeries, to do that to someone, to extensively cut everything out and not tell them, like, you got to wonder where someone's head is at when they're doing that to you, and they send you home. And I was calling his office, like, I was just like dying here after the surgery in unspeakable pain. And I was calling his office and leaving messages saying, why do I feel like someone has taken a baseball bat and cracked me as hard as they can across the face with the baseball bat? Why do I feel like bones, like my face is broken? You know why? Because he removed bone without telling me. Cut out bone, big chunks of bone. Imagine doing that to somebody when they're asleep, cutting bone out of them without their knowledge. Like, you got to wonder where someone's head is at to do that to somebody. You know what? I woke up during that surgery. Imagine doing that to somebody underhandedly, and the patient waking up during the surgery. It's like almost like getting caught red-handed, right? And then stopping breathing after the surgery. And they sent me home after I stopped breathing in their care. They sent me home with 40 opioids after I had just stopped breathing in their care. And I warned them, something's wrong with my breathing. Like, this is just... And I'm scared, because if someone can't help me when this pain is escalating, when the pain is this bad, I'm in big trouble here. Like, I'm going to be like, I'm already losing it. Like, I hope my doctor responds somehow. I don't know what's the answer other than assuming it's a sinus infection. And you can't be doing antibiotics nonstop. So what's the solution?